In this video, we will review umbilical catheter insertion. Before I start, I will review the indications for the patient. Do I need to insert an umbilical arterial catheter, umbilical venous catheter, or both? Remember, under emergency situations, most healthcare providers would prefer to insert an umbilical venous catheter. Then we'll examine the patients for any contraindications, for example, omphalocele or gastrocases. Review the weight of the patient to ensure I'm choosing the correct catheter size and do the measurement for the catheter length of insertion. Next, we'll go to review the umbilical catheter kit, ensuring that I drop the correct catheter size, whether single or double lumen. Flush your catheter and the connector with saline, making sure you view saline coming from the other end. Will make off to the catheter to avoid any air embolism during insertion caused by the negative intrathoracic pressure. Now, we'll hold a long forceps, give it to my colleague to hold the umbilical cord clamp vertically to help me doing the disinfection. Please review your organization policy for the best disinfectant, whether full term or premature. When you start from the top, making sure you do as well the umbilical cord clamp from the top and the bottom, and go in a one direction movement. I will repeat this process 3 times. Next, I will get sterile towels to apply to my field. You can use either 4 towels around the umbilical cord stump, or I'm going to use 2 towels in a V-shaped way. So hold the towel from both corners and apply it to the field. And we'll repeat the same process. Get the towel, hold it from the opposite corner to do this V-shaped, and then we'll apply it on the other side. To ensure my body is not touching the crib of the baby, we'll also put a sterile towel on my side and as well on my colleague side. Now we'll get an umbilical cord tie, go around the base of the umbilical stump close to the abdomen. Make sure you don't tie it securely hard to avoid closing your arteries and vein, and also don't leave it that much loose. The goal is when you have bleeding, you can secure it tight to prevent any blood loss. Next, I will get a scalpel. Make sure you go 1.5 to 2 centimeters away from the abdominal wall. When you cut, I'm aiming to cut horizontally. And once I'm done with this process, I will start to review my umbilical cord stump to vision the 2 arteries and vein. Remember, arteries do have thick muscle wall, so when I cut, they can spasm, so they look only like dots. Vein, much more easier to visualize. If you are planning to go for an umbilical artery catheter, you can use a curved artery forceps. Very gently, you go into the tip of the umbilical artery and you dilate very smoothly to just overcome this smooth muscle contraction. This will help ease a little bit going with the umbilical artery. Same if you go for umbilical vein, if you have any blood clots, you can remove it away. Then I will get the umbilical catheter, ensure that I landmark the exact depth I'm intending to go for with my finger. Double check to ensure that the catheter is closed, flushed with saline to avoid air embolism. And now I'm going to get a toothed forceps to help me with insertion. With the toothed forceps, you will hold umbilical cord vertically and try a little bit gentle traction upward when you are inserting the umbilical catheter into the vein. This will help to overcome the structure that is happening between the umbilical stump and the abdominal wall, just to go into this narrow area. Once I reach 5 centimeters, we'll stop, aspirate to ensure I have good backflow. This is to avoid just keep going and creating a false tunnel. Once I'm sure I'm in the correct place, now we'll proceed until I reach the desired length of insertion. Again, once I double check the desired length of insertion, I need to aspirate again to ensure that I do have good backflow of blood. Now we'll close and start the process of fixing the catheter in place. Using the needle holder and a 4-0 suture, I'm going to start by creating a knot into the Wharton jellies of the cord. The first thing, you go by your suture close to the catheter insertion, avoiding going through the catheter or the vein, just into the Wharton jelly itself. Once I did this step, I will go and create 3 knots. These knots will be how I'm going to fix the catheter to these knots later. So first knot, as you can see, it is not going anywhere through the catheter, it just through the Wharton jelly. And the third one. Now my second step I'm aiming is to secure this catheter to these knots. So I will hold the suture line parallel to the catheter and then go around the catheter and through the suture line I'm holding. Again, hold the suture line parallel to the catheter, go around the catheter, and then through this suture line I'm holding. And the last one, again, hold, go around the catheter and through the suture line. Next, I will get my needle holder again, and I want to do another knots into the Wharton jelly, 180 degree opposite the first knot I did, on the other side of the catheter, again into the Wharton jelly, ensuring that I'm not going through the catheter, the vein, or the artery, only through the Wharton jelly. This part that I'm doing now is to make sure that the catheter will be held in the middle of both these knots. It's not being tracked to one side. Once I'm done with doing 3 knots, it's very important to double check the depth of insertion to ensure that during the suturing process, the catheter was not displaced up or down. Also, aspirate to ensure that you have a good backflow, that the sutures did not close on the artery or vein. Once this process are done, please do not secure your line finally until you do radiological confirmation. During the radiological confirmation, I will start infusion at a rate of 1 ml per hour into the catheter to avoid any clot from forming while we are preparing and doing the X-ray. X-ray confirmed that the catheter placed. Now I can go to do the final securement of the catheter using a strain relief bridge tape. The goal of the strain relief bridge tape is to ensure that I'm going to loop the catheter into this bridge to ensure when I am any traction on the catheter is not being translated directly to the cord, but is going to happen on the strain relief bridge tape. I'm done. Now I'm going to remove any excess skin preparation, expose both lower limb to check for any poor perfusion, and ensure to observe the baby for a minimum of 1 hour for any oozing or blood loss. Thank you, and I hope this video on umbilical catheter insertion was helpful. Please, if you have any comment, share it with this email.